Donald Trump announced he'll impose high tariffs on copper and pharmaceuticals.
He has been celebrating since late last night. Just before midnight, he posted that billions of dollars, quote, largely from countries that have taken advantage of the United States.
My administration has already taken significant steps to get drug prices under control.
Drug prices in America could be on the brink of a massive shakeup. The Trump administration is considering tariffs as high as 200% on imported medicines, a move that could increase costs, disrupt supply chains, and alter healthcare forever. Will this bold gamble save or sink patients? Let's dive in. Chapter 1. The announcement that shook pharma. Let's get straight into it. Recently, the Trump administration floated one of the boldest economic ideas we've seen in healthcare: tariffs as high as 200% on imported drugs. This isn't just a casual tweet or offhand comment. Reports indicate it's under serious consideration, and the pharmaceutical world is already on edge. Think about it. A 200% tariff means that if a drug costs $50 to import, suddenly the cost jumps to $150 before it reaches your pharmacy shelf. That's not a small change. It's a potential earthquake in the healthcare system. And this won't happen in some distant future. The discussions are happening right now, and pharma companies, lobbyists, and healthcare providers are scrambling to figure out what it means. Some are calling it a bold step toward independence. Others are warning that it could trigger chaos in an already fragile system. So why medicine? Why now? Chapter 2. Why tariffs target medicine? The reasoning comes straight out of the America First playbook. For years, politicians on both sides have warned that the U.S. is too dependent on foreign suppliers for critical drugs and ingredients. Roughly 80% of active pharmaceutical ingredients, the core building blocks of medicine, come from outside the U.S. China and India dominate this supply chain. Now, think about the risks. If a global crisis hits, or if geopolitical tensions flare up, America could find itself in a dangerous position where life-saving drugs are delayed or cut off entirely. During the pandemic, we already saw what supply chain disruptions did to everything from masks to ventilators. Think about what is happening with antibiotics, insulin, or cancer drugs. So, Trump's argument is to slap tariffs on foreign drugs, make them expensive, and suddenly American companies have a strong incentive to bring manufacturing back home. More U.S. factories, more jobs, and less reliance on overseas suppliers. On paper, it sounds like it is protecting national security while boosting the economy. Chapter 3. The industry's shockwave. The pharmaceutical industry's reaction. Pure shock. Trade groups and healthcare experts immediately sounded the alarm. Why? Because medicines aren't luxury items, they're essential. If you triple the cost of imports overnight, those costs don't just disappear, they trickle down. Pharmacies pay more, insurance companies pay more, and ultimately, you pay more. Healthcare experts warn that instead of building self-sufficiency, these tariffs could backfire by pushing patients out of the system. Some might skip doses, delay refills, or avoid treatment altogether simply because prices spiral beyond their reach. And that doesn't just hurt individuals, it puts more strain on hospitals and emergency rooms when untreated conditions become emergencies. Pharma companies themselves are also in a bind. Many US-based firms still rely on raw materials and finished drugs from abroad. A 200% tariff means they'd either absorb massive costs or pass them down to consumers. Spoiler alert, most businesses don't like eating costs. They pass them along, and that's why the phrase chaos keeps popping up in industry conversations. Some experts say this move could trigger shortages, stockpiling, and even black markets for critical drugs. The uncertainty alone is enough to send ripples through Wall Street and healthcare policy circles. Chapter 4. What this means for everyday Americans. Let's zoom in for a second. What does this mean for you, your family, or anyone filling in a prescription? Well, if tariffs go through at the level being discussed, the impact could hit almost immediately. First, higher pharmacy bills. Generics that normally cost $10 could suddenly jump to $30, $40, or more. Insurance might cover part of it, but higher costs eventually mean higher premiums too. It's like squeezing a balloon. The pressure just shifts around, but you're still paying for it. Second, reduced coverage options. Insurance companies might decide not to cover certain imported drugs if tariffs make them too expensive. That forces patients either to pay out of pocket or switch to alternative treatments, which aren't always as effective. Third, the human cost. For seniors on fixed incomes or families already drowning in medical bills, even a small price hike can mean tough choices. Groceries or prescriptions, bills or insulin. Multiply that by millions of households, and you start to see why critics are panicking. And tariffs are supposed to strengthen America. But if patients can't afford their meds, the country gets weaker, not stronger. Chapter 5. Supply Chain Pressure Points. Now let's get into the supply chain side, because this is where things get really complicated. Most people don't realize just how global the drug-making process is. Even if a pill is bottled in New Jersey, the active ingredients inside it might have been made in India, the filler might come from China, and the packaging might come from Europe. So, when you slap a 200% tariff on imports, it doesn't just hit foreign-made drugs sitting on a shelf in another country. It hits the raw ingredients, the intermediate chemicals, the components that US companies rely on. That's where the real pressure point is. Experts warn that even a small tariff increase can ripple through the entire pharmaceutical ecosystem, causing bottlenecks and delays. A 200% increase? That's like dropping a sledgehammer on a glass table. Every link in the chain, manufacturers, distributors, pharmacies, feels the shock. Rebuilding US drug manufacturing isn't something you can do in 6 months. It takes years to build FDA-approved factories, train staff, and meet compliance standards. So even if tariffs push companies to onshore, the short-term pain could be brutal. Chapter 6. Big Pharma's Countermove. Now here's where it gets interesting. While politicians throw around numbers like 200% tariffs, the pharmaceutical industry isn't just sitting back and waiting. Big Pharma is already moving its chess pieces. Several major drug companies are announcing plans to expand US-based production. We're talking about new factories, new supply chains, and potentially thousands of new jobs for American workers. On paper, that sounds like a win. Politicians love it. They can point to job creation and say, "See? The tariffs are working." But building and running pharmaceutical plants in the US costs a lot more than doing it overseas. Labor costs are higher, regulations are stricter, and infrastructure takes years to build. And guess who ultimately pays for those higher costs? That's right, patients. So, while companies may make these flashy announcements, don't be fooled into thinking it's all good news. The reality is that even with more local production, drug prices could still rise. Chapter 7. Political and Public Debate. Of course, this isn't just an industry story, it's a political firestorm. Supporters of the tariff plan argue that it's about national security. They say America shouldn't be at the mercy of China or India for life-saving medicines. Think about it. If global tensions rise, access to critical drugs could become a weapon in international politics. That's a scary thought. On the other hand, critics are warning of a healthcare disaster. They argue that imposing such high tariffs before America has the infrastructure to handle production is like cutting off the lifeboats before the ship is even built. Patients could suffer shortages, hospitals could face crises, and insurers could hike premiums. And public opinion? Completely divided. Some Americans cheer the idea of bringing drug production home, no matter the cost. Others are terrified about what this could mean for their wallets and their health. Think of being a senior living on a fixed income, already struggling with high copay, and suddenly your medicine costs double. For many, that's not just an inconvenience, it's life or death. This debate is heating up fast, and every politician, advocacy group, and healthcare expert has something to say. Chapter 8. The Road Ahead. Here's the most important thing you need to remember. Nothing is final yet. Right now, this is still a proposal. It could be watered down, delayed, challenged in court, or reshaped in negotiations with trade partners. And let's not forget other countries might retaliate with tariffs of their own, sparking a wider trade war that drags on everything from cars to electronics. So where does that leave us? In uncharted territory. The pharmaceutical industry is bracing for change. Patients are bracing for higher bills. Politicians are bracing for the fallout. The only certainty here is that this is a turning point in how America thinks about drug policy and healthcare economics. We're watching history unfold in real time, and the decisions made over the next few months could reshape medicine in this country for decades. This isn't just about economics, it's about people's lives. A 200% tariff could reshape healthcare access in ways we've never seen before. Whether it strengthens America's pharmaceutical independence or crushes patients with costs depends on what happens next. What do you think? Will tariffs make medicine safer and cheaper or push prices out of reach? Comments below. If you find this video helpful, hit like, subscribe for more of the biggest stories shaping the world.